everybody, I'm Dr. Susan Brown, Director of the Center for Better Bones. In this week's blog, I'm sharing with you some really fascinating research that I found that was done in Canada. And this research looks at how we can protect ourselves from radiation damage that's incurred from medical testing procedures using a series of antioxidants. This topic is particularly interesting to me for a couple reasons. One is that in my life, I've had 2 CAT scans. One when I fell off a roof, and they had to do a CAT scan right after the fall to make sure there was nothing wrong with my neck or my head or like that. I didn't really have time to prepare before that. The second CAT scan was because I had some abdominal distress, and my friend who's a doctor said, you really should get it checked out. And so they gave me a CAT scan. In this case, I did have time to do a protocol beforehand to protect the body from radiation damage, but I didn't know about the protocol. Recently, doing research on bone health, I came across this protocol from the University of Toronto. You can see in the blog the details, but these researchers very carefully started to look at the great increase in CAT scans and started to think this is really getting to be a significant impact, a significant increase in our X-ray and in our ionizing radiation exposure. And so they said, let's see if we can reduce that damage using a series of antioxidants. Now, this is also important for us in bone health because these days they've discovered that the bone density testing, which does use X-rays but in a very, very small radiation exposure, that they cannot predict bone strength. On the other hand, CAT scans can tell us much more about bone strength, but the radiation is really significant. I've seen several pieces of research talking now about using some part of CAT scans, whether it's the wrist or a particular part of the spine, to actually predict bone strength. So each of us should be knowing more about how we can protect ourselves from the radiation exposure, particularly occurred through CAT scans. In the blog, I give you a chart showing the different levels of radiation exposure. Some things like bone mineral density, dental X-rays are very small exposure, yet it's all cumulative. It all damages the DNA, some to a lesser degree, some to a greater degree, and it's quite long-lasting in the body, so I'm suggesting we all pay more attention to how we can protect ourselves. What these researchers up at the University of Toronto did is they took a number of people who were going to have CAT scans. Some of them they gave this simple antioxidant protocol to, and the others they didn't. The people that had the antioxidant protocol showed much less damage to the DNA from this CAT scan. One of the important things to keep in mind is that they gave this protocol 5 days in advance, every single day, 5 days before the test, because you want to build up your antioxidant stores before you get this radiation exposure. I could have done that in my second CAT scan. I couldn't have done it in the first. An interesting part of this protocol that you're going to see in just a second is that vitamin C is included. Other researchers have shown that even if you can't do the antioxidants before the CAT scan, if you take it right after the CAT scan, if you take vitamin C right after the CAT scan, that will be also protective to a significant degree. The great solution, of course, is to use antioxidants on a daily basis, to take lots of colorful fruits and vegetables that are high in antioxidants, and always have high antioxidant reserve. But this specific protocol to help protect from CAT scans is as follows. And this is really well tested. It was shown to be quite effective. Just a few simple nutrients. They use 2 grams of ascorbic acid. That's 2,000 milligrams of vitamin C. We, of course, like the buffered ascorbate form that has a small amount of minerals with it. It's a powder, very easy to use, 2,000 milligrams of vitamin C. 800 milligrams of lipoic acid, which is another excellent antioxidant. 1.2 grams or 1,200 milligrams of n-acetylcysteine, another key antioxidant, and 30 milligrams of beta-carotene. Now you can find this protocol right on the blog. These are very common nutrients, very common antioxidants, and simple procedure. 5 days before your CAT scan, take these. I would continue them some days after myself. In my own personal case, I take many of these antioxidants on a daily basis anyway. If you get caught in a situation where you have to do a scan immediately, be sure to take that vitamin C. 2 or 3, 4, 5, 6 grams of vitamin C would be a big help. And in the meantime, I hope everyone stays well. Just kind of keep this in your file. If you have to get a CAT scan, we can protect ourselves. It's very interesting to note that there's always background radiation, and today in the U.S. that measured on a scale of 3. Well, now we've doubled that with the medical radiation. The radiation we get from medical exposure has doubled us to a level of 6. So we've doubled our radiation exposure with these medical tests. Good to pay attention to limit all radiation exposure, and when we can, to keep a nice high antioxidant status in the body, and particularly to do this very interesting Canadian protocol should you have a CAT scan, a nuclear scan. And if you wonder how much radiation you're exposed to, we've attached a chart that kind of helps you sort out the different X-ray and scanning techniques. No need to worry. Sometimes we really need the scans, but we can do a little bit better to protect ourselves with antioxidants. Be well, and I'll talk to you all soon.